Hi, I'm Dr. Chan here at Crown Dentistry. We get a lot of questions about teeth cleaning. So today, I'm going to answer some of the most basic questions and most common questions about this topic so that you have a better understanding of teeth cleaning appointments. There are a couple of different kinds of cleaning. A lot of it depends on how healthy or unhealthy your gums are. If your gums are relatively healthy and your teeth are relatively healthy, meaning you've been good about coming to the dentist on a regular basis, or if you just genetically have really good teeth, you might be okay just getting a general prophylaxis or general cleaning. That's one where the hygienist or the dentist will basically clean plaque, which is bacteria and food particles, or calculus, which is hardened plaque, off of your teeth and your gums above the gum line. Sometimes people have a little bit more buildup, either plaque or calculus on their teeth, and they require either another general cleaning or they might need something else, such as root planing or periodontal treatments. So dental cleanings are really important because what they'll do is they stop things from building up in your mouth. I'm sure you've heard it said that your mouth is one of the dirtiest places in your body. And it's true. It's because we put so many things in our mouth, whether it's food or drink or our fingers. Basically, that introduces a lot of bacteria and foreign objects into your mouth. As a result, things tend to grow on your teeth, on your gums, around your tongue. And so dental cleanings are really important for just keeping all of that down to a manageable and a healthy level. The frequency of dental cleaning often varies depending on how healthy your teeth and your gums are. If you're relatively healthy, you may be okay just getting a cleaning every 6 months. A few lucky people sometimes can get them once a year. I would say most people need them at least every 6 months though. However, if you tend to maybe not brush as well, despite your best efforts, or if you tend to build up more plaque or bacteria, you might need to get a cleaning more frequently. Maybe every 3 months or even every 4 months. How uncomfortable or comfortable a dental cleaning is often depends on how clean your teeth are when you come into our office. If you've been pretty good about brushing and flossing and taking care of your teeth at home, dental cleaning's pretty comfortable, not too unpleasant at all. If maybe you've been a little bit lax about brushing or flossing, or maybe you just don't floss or brush at all, sometimes cleanings can be a little bit more uncomfortable. We do our best here at Crown Dentistry to make it comfortable for you. Sometimes our dentists or hygienists can put a little bit of numbing gel on your gums and your teeth in order to make it more comfortable during the cleaning. So the frequency and duration of the cleanings often depends on how clean your teeth are when you come into the practice. That you've been pretty good about taking care of your teeth. Sometimes cleanings will go relatively quickly, maybe even 30 to 40 minutes. If our hygienists or our dentists need to work a little harder to get your teeth clean, it might take a little longer, maybe up to an hour. Usually, it doesn't take longer than that, at least for one session. If our dentists or hygienists feel like more treatment is needed in order to get your mouth and your teeth to a healthy state, then sometimes we will schedule a follow-up cleaning appointment. So teeth cleaning appointments can go a couple of different ways. Usually, our dentists and hygienists will start off by checking your gums and your teeth to make sure there aren't any really severe problems such as big cavities or infections or abscesses. A lot of times they'll also do an oral cancer screening in order to make sure you don't have any early signs or even later signs of oral cancer. Then usually what will happen is they'll start cleaning your teeth, meaning they'll usually use our dental instruments to start cleaning the plaque and calculus off of your teeth. Sometimes that might involve a little bit of scraping. Sometimes it'll involve just a little bit of washing away of the plaque and calculus buildup. After that's done, the teeth will be polished by the dentist, the hygienist, or by a registered dental assistant. When the polishing is done, usually that's done with some slightly abrasive toothpaste. Then usually the last thing that's done is flossing to remove any remaining plaque or calculus or even toothpaste. Sometimes at the end, they'll be given the option to rinse your mouth out with either water or mouthwash. So sometimes our patients will ask if all of the buildup is removed during a dental cleaning. That is definitely our goal in order for you to leave our practice after a dental cleaning with no buildup. We will do our best in order to make sure that your mouth is as clean as possible. Sometimes there are limitations based on the sensitivity of the patient and or the ability or inability to stay in the chair and sit still. The goal of every dental cleaning is to remove as much plaque and calculus as possible. If dental cleanings are done properly, your teeth will not be damaged. Our teeth are extremely durable and strong. The enamel, which covers the tooth surfaces above the gums, are the hardest substances in the human body. So even though we have instruments that are made of metal and plastic and are very durable, our teeth enamel are more than strong enough to withstand a little bit of abrasion and cleaning from these instruments. Sometimes people feel a little bit sensitive after their dental cleanings. This is completely normal. A lot of times the teeth are a little bit irritated just from being pushed and scraped and prodded from our dental instruments in order to remove any harmful bacteria or buildup. What we usually recommend for people to minimize the post-cleaning sensitivity and or discomfort is to either use an anti-sensitivity toothpaste or a higher concentration of fluoride toothpaste, or to rinse for the next couple days after the cleaning with either mouthwash or warm salt water. There are several ways for you to get in touch with our office in order to schedule a cleaning. The first one is to give us a call on the phone. Our phone number is 916-285-9678. You can also reach us via email. Our email is crowndentistry@gmail.com. If you just email us, state your name and your desire to get a cleaning scheduled, we'll get back to you as soon as possible. The last way that you can schedule an appointment is to our website, www.crowndentistry.net. There's an option there to fill out forms to schedule a cleaning appointment, or you can give our new patient line a call. I hope we've been able to answer some of your questions on dental cleanings. If you have any additional questions, or if you're ready to take action, please give our office a call at 916-285-9678. We're here to help.